From questions about the coronavirus and your health to plans of reopening Texas, we're talking to the experts today, ready to answer your questions.
Connecting Central Texas. This is 25 News.
Good afternoon, everyone, and thanks so much for being with us on this Friday at 3:30. We're trying something a little bit different today, a virtual town hall. We're answering all of your questions about all things COVID-19 with the experts who know that subject best. From medical questions to safety, even stimulus check surprises in your bank account, we're going to cover it all. I want to take a minute to just introduce our panel right here because we have some fine folks who have joined us. We have a CPA and financial expert, Mike Lucas, who's a partner at Patillo Brown and Hill here in Waco. Dr. Brenda Gray, who's the director of public health in McLennan County. Dr. William McCunough, who does family medicine here in Waco at Hillcrest, Baylor, Scott & White. Elizabeth Thomas is the McLennan County Emergency Management Coordinator. And James Roberts, who's the director of Center for Nonprofit Leadership and a marketing professor over at Baylor University. First, we want to thank you all for joining us. There's a lot to get to, so let's just dive right in. Dr. Gray, I want to begin with you, and we hear this still so much from viewers. What is COVID-19? So if you can, just break it down as simply as possible. What is this virus, and how is it different from other strains of coronavirus?
Thank you for that question. And I want to just say welcome to the panel that's joining us. And I appreciate this opportunity to come and talk with the audience about this novel disease. And I just want to start by saying, breaking it down, COVID-19. And so the CO stands for corona, the VI stands for virus, and the D stands for disease. And of course, 19 is the year that it was identified. So we have that short word, COVID-19. It's a novel coronavirus, a new disease that was identified, as we know, in Wuhan, China in 2019. But there are many types of coronaviruses, like the common cold that cause respiratory tract symptoms or illnesses, such as the common cold. So I think sometimes people confuse the terminology coronavirus with novel coronavirus because we've had coronaviruses among us before. But this is novel because it has not been detected or identified in human beings until December 2019. Sometimes people have said it's like the flu, and it can be similar to the flu, but it's much more severe than the flu. It's much more contagious. And we have very limited knowledge about this virus. We're probably in the 5th month of really trying to discover how this virus is passed on, the types of severity that and conditions that people are experiencing with that. So we don't want to confuse it with the normal flu or with some of the other flu-like symptoms or things that people are experiencing today. I think one of the things we need to really be concerned about is identifying what are those symptoms that people should be looking out for. And I think that the public health infrastructure across Texas and the United States has done a very good job in identifying those symptoms to look out for. And the first thing is the cough, the fever, and shortness of breath. And we have very specific guidelines about how to interact with the healthcare system, because we want to make sure we could continue to flatten that curve and make sure that our healthcare systems and resources could be able to withstand the additional crisis care that is being provided right now. And so just to reiterate some of those messages, if you have those symptoms, we want you to connect with your doctor first, get that online assessment before going to the emergency room or to an actual physical clinic, and they will give you specific directions on how to access those services to not only protect yourself from being infected, but also protect our healthcare providers and first responders from being infected, and really flatten the curve and reducing the spread of COVID-19.
Sure. Dr. McCunough, I want to bring you in here briefly. Testing concerns, are all over the country. It continues to be an issue in some larger cities. What are you seeing about the availability of tests here in Central Texas? Is that something you're concerned about? And why is it so important that people do get tested?
Thanks, Todd, and I appreciate the question. And I would kind of just emphasize a lot of the same attributes that Dr. Gray mentioned as well, is that the first step that someone should do if they think that they have questions is call your doctor. And so after, someone calls me, which as a primary care doctor, I take these calls a lot. And so I talk with the patient and discuss with them what their symptoms may be. Is it fever, cough, shortness of breath? Is it more allergy type symptoms? And then what are the underlying medical conditions which would increase their likelihood for complications? Now, we're able to do that a lot of times via video visit versus someone showing up at our clinics or at the ERs, which is a whole lot safer for the whole community. And that kind of ties into your question about the testing specifically. Is yes, would we love to check every single person? Yes, that would be a fantastic goal for us to get to. But we are not quite there where we're truly testing every single person. And I think that as times goes on and as we develop more and more testing availability, we'll be able to improve that testing for a larger population. And specifically, we are able to check most of those that do have the high risk comorbidities and those with symptoms.
Are you concerned about the reliability of some of these tests? I mean, we've heard about false negatives, false positives. That has to be something that you're thinking about.
I'd say that is something that I do think about, and I've read a lot of those same articles, and I've seen that number as high as 30%, but I wouldn't say across the board that changes a ton in my management of a patient with those symptoms, because the treatment is still going to be the same in those with mild to moderate symptoms. Can be a stay at home, continue to self quarantine, stay away from those who do not have symptoms. But then for sure, keep me updated. I want to continue to talk to those people. And if I had concerns that someone would potentially may have had a false negative, then I would approach that patient individually and we'd look at other testing and other options if needed.
Sure. Let's switch gears just a bit here. Within the past 24 hours, President Trump, of course, announcing some guidelines to slowly reopen America. And just a few hours ago, we heard from Governor Abbott here in Texas about what a phased reopening might look like. Let's bring in Elizabeth here, McLennan County emergency management expert. Elizabeth, what are you anticipating to play out locally here in McLennan County? It sounds like the way the governor is handling this, there's going to be a lot of county by county discretion on when they can phase out these shelter in places, when restaurants can reopen. How do you anticipate that playing out?
Definitely. Recovery is something that we have been working on and planning towards, and even the thing is, even for a while here, we're still going to be responding for a while. I mean, this isn't going to go away overnight. So we have started, looking at what the recovery process looks like. Dr. Gray and I we had a conversation this morning, and, it's going to be a balance between, getting the businesses reopened, getting the economy going again, but also making sure that our healthcare systems are stable, that they have the resources that they need if they're going to have to surge for, let's say we had an influx of positive patients, and, kind of balancing the two of those and looking at the phases. We're following the guidelines from, the federal that President Trump released yesterday and that Governor Abbott has put out today, and making sure that we're staying aware of what's going on at all levels. Not only looking at what's happening in McLennan County, but what are our surrounding counties doing as well to make sure that we are doing this together and working the best we can.
So this isn't something that's just going to happen overnight.
No, definitely not. No, it's going to take some time. We're going to have to really look at the numbers and look at the cases, making sure that we are still flattening the curve and that we continue to flatten the curve and make sure that our healthcare systems can stay as strong as they're staying right now. We don't overwhelm them.
Sure. All right. Well, we are going to take a quick break, everyone. Don't go away. We're coming right back in just a couple of minutes to resume the virtual town hall. We're going to get some input and answer some questions about finances and stimulus checks. That's coming up next. Virtual town hall on this Friday afternoon. Let's talk a little bit about money, because a lot of people are thinking about that these days. Many questions we've received focus on federal stimulus checks that they started hitting bank accounts last weekend into this week. The government has broken down those mandates into basically 3 tiers. Anyone whose annual income in 2019 was less than 75 grand, anyone who's made less than $112,000 the head of a household, or married couples who earned less than $150,000 annually. So for a lot of people, this is coming out to about $1,200 roughly. Mike, first off, do you really think $1,200 is going to make enough of a difference to get the economy churning again?
Well, there's a lot of programs out there that this is just designed to be one of them to help supplement. The unemployment has been beefed up as well, and there is also some small business, some help for small businesses along the way to keep helping the employees getting a check. And so it's meant to be a supplement. Now there are reports that there may be a second stimulus coming, but it is not an end all do all, but definitely part of just to help keep it going and keep it from collapsing.
You mentioned these other resources here in Texas. What are a couple of those that people should really look at?
Well, a couple of the big ones were they're funded through the SBA, Small Business Administration, and they were geared at small businesses. There were a couple of them, we call them the EIDL loans, and then the PPP, which is a Paycheck Protection Program. And these were loans, some of them to be forgiven, that small businesses have been applying for to keep the paychecks or to keep paying their employees. This has been a tremendous program. In the CARES Act, there was $350 billion initially set aside for this program. As of yesterday morning, that 350 had all been used up. And there are ongoing discussions to do another injection into that to keep that program going. I saw a report this morning where the SBA had actually done, they had processed more applications or funded more loans in the last 14 days than they have in the last 14 years, something kind of rough to that. So that has been a huge program that was put out there to help the small businesses and to funnel it to the employees, obviously, that these stimulus checks would be a supplement.
You and I were talking about this a little bit earlier. Whenever the government moves at this pace that they've been moving at, which is very quickly for anything government related, there are going to be mistakes. We have viewer emails, questions. One lady named Tiffany wants to know, what should she do if her stimulus check was deposited into an account that doesn't belong to her, even though she thought she had given the right information? You're hearing stories like that.
Absolutely. And this, you bring up one in particular. But yes, that there were hundreds of billions of dollars and this program was set up, the CARES Act, so fast and on such a large scale that there is no way to have gotten the procedures perfect. I mean, there is going to be a lot of trial and error. You're already starting to hear as much as 10%. Once this whole process is over. Now, the question you mentioned, there's been several reports, and it related to people that would go have their tax returns done at smaller accounting services, and they a lot of times get these refund anticipation type of loans, and they get it in the form of a credit card. So what is happening is on the IRS website, there is a tool, Get My Payment. So they're going out there and they're checking that, and they're seeing that the bank account, the last 4 digits, is not their bank account. Well, what it is, it's a master account of this service that actually did the refunds. And so that's kind of some of the confusion. Now, I know that those banks and those preparing services, they're working on getting it straightened out. So you're going to have a lot of that. And IRS has some good resources. As I said, that Get My Payment tool is a good place to start, but there is definitely going to be some payments going to the wrong place and being misapplied, et cetera. So,
yeah. Here's another question: do people receive SNAP or other forms of federal assistance? Do they qualify for the payment?
They do. That one's not going to be related to the other, or the stimulus is not going to prevent them. It doesn't count as income and somehow deter their benefits or keep them from getting benefits. They are two total separate programs.
Jim, I want to bring you in really quickly before we go to a break. Whether it's 3 weeks or 6 weeks from now, what do you anticipate it's going to be like for people to be out again?
Yeah, I have a pretty clear understanding of the way I like to think of it as going to be a slow return to a new normal. And what I mean by that is we take indicators from China and Europe. Here's what it's going to look like as a consumer going forward. First, to enter any type of a building, whether it's a restaurant, shop, or a place of business, our temperature will be taken. We'll also be asked to wear gloves and masks indoors. And this is also certainly going to be staggered by counties and states. So in all responses to something of a recession or a pandemic like this, the recovery is always based upon the consumer spending. So I always refer to it as consumers are kings. And so we're going to have a real problem bouncing back from this particular pandemic for three reasons. First, by the time this is over, unemployment is going to be at least 15%. So when we go back into the post-pandemic, or even just starting to try to respond to a kind of slow return to new normal, there's still going to be a high percentage of unemployed people. And so that's lost spending. People are going to go back to work, some of us, but they're going to go back at lower wages, reduced hours. And so that's certainly going to cut back on spending as well. And then what about all the forgiven, mortgage payments and car loans and credit cards that need to be paid for as well? And then really the biggest concern of mine is that when we do, kind of get the green light or maybe yellow light to go back out and into the world, that we're going to still be, as consumers, very worried about. I know I'd be very trepidatious between now and the next 2, 3, 4 weeks to go into big crowds, travel on public transportation. So I think it's going to be a slow and maybe even a torturous return to normal, but hopefully it'll be one that we'll learn from the mistakes that others and we make, and along the way we'll kind of figure it out.
Sure. Thank you. We're going to take another quick break and we'll be just back in a couple of minutes. Stay with us. Welcome back to our virtual town hall on this Friday. We are getting answers that you asked. We're getting those answers and responses from the experts today. Cassandra would like to know, like strep throat, can the coronavirus be contracted more than once? Dr. Gray, we'll go to you on this. Can you get this thing twice?
That's a good question. And our scientists and researchers across the United States and national are looking at that. And we're just not sure. There's some data coming out of, I believe, Korea, where there's a number of people who have been reinfected, but they're not sure if it's the same infection or a new infection. So again, this is a novel coronavirus. We've learned a lot about it. We have a lot to learn. And that's just a question the science and the evidence has not definitively answered for us at this point. And so what we are advising is that we continue the respiratory hygiene, washing your hands frequently, not touching your face, wearing a mask or face shield when you're out in public to reduce your chances of contracting or infecting someone else. And those protective measures are the best things we can do right now.
Sure. Mike, I want to bring you in again here quickly. We've heard so much about the job market and the 22 million Americans who are now filed for unemployment. How long does it take to come back from something like this, or is that just a big question mark right now?
I think it's a big question mark. When it all started, everything went so far down so fast, and the initial reports were they're saying it's going to be a V. It's going to go down fast and then come back up fast. I don't think that the reports now indicate that's going to be the case at all. I think as Jim stated, it's going to be a slow, gradual. There's going to be a lot of things that have to happen. But I think with the governor, it's going to be a slow baby steps, and we're going to get there. But it's not going to be an overnight process at all.
All right. Well, we're going to take another quick break, and then we'll be right back for some final closing thoughts. Thanks for being with us on this virtual town hall. Much more available at kxxv.com.